Today, we're diving into the heated debate over overdose prevention centers in the UK. There's a
Yeah.
lot to unpack.
Oh, I've been hearing a lot about that lately. What's the latest development?
Well, over 80 prominent organizations are calling for pilot overdose prevention centers, but the government has, no plans to introduce them. It's quite
Really?
concerning.
That's surprising. What's the government's reasoning?
They argue there's insufficient evidence to show that these centers are beneficial. But, it's like ignoring a fire alarm because it hasn't been tested in your own house. It
Right.
doesn't add up.
Haven't these centers been successful in other countries?
Exactly. They've been introduced in at least 14 countries across more than 130 sites.
Wow.
They provide a safe environment for people to use drugs under supervision.
So they offer immediate help, like naloxone and oxygen?
Yes, and they also provide psychosocial support and needle and syringe programs.
That's great.
They're comprehensive.
Observational evidence shows they reduce fatal overdoses?
Exactly. Fatal overdoses decrease in areas where these centers are introduced. It's
Mhm.
significant.
But the government wants randomized controlled trials, right?
Yeah, but expecting RCTs for community-level interventions is, well, it's a bit unrealistic.
Yeah.
It's a huge undertaking.
Why is it unrealistic?
Because conducting an RCT on this scale would be enormous, expensive, and might never happen. It's like expecting a full-blown experiment to prove that parachutes save lives before we use them. It's impractical.
Good analogy.
Many public health interventions have been introduced without RCTs when their mechanism is clearly understood.
Right.
So why the double standard?
So the demand for RCTs here seems inconsistent?
Exactly. It might relate to moral perceptions of illicit drug use. There's a
Mhm.
bias.
You think society's judgment towards drug users affects policy decisions?
Precisely. There's this inconsistent requirement for more rigorous evidence when it involves drug use. It's unfair.
RCTs didn't show the effectiveness of opioid agonist therapy for reducing mortality, but it's still recommended?
Yes, based on observational evidence and clinical experience.
Got it.
So we're holding overdose prevention centers to a higher standard.
That seems inconsistent.
Exactly. It's, not justifiable. We need to be
Agreed.
pragmatic.
What's the second argument against these centers?
Some say that overdose prevention centers condone illicit activities. That's
Do they?
questionable.
But they don't necessarily condone or condemn drug use, right?
Exactly. They're a harm reduction intervention aiming to reduce negative outcomes.
Right.
It's about safety.
There's no evidence they increase drug use?
None at all. In fact, they can promote engagement with drug treatment services. It
That's
helps
important.
users.
So they might support drug use cessation?
Yes, if that's the individual's goal. It's empowering.
The argument that they condone drug use doesn't hold up then?
Not really. It's similar to when needle and syringe programs were first introduced during the HIV epidemic. History
right.
repeating itself.
Those programs were controversial at first, but now they're accepted?
Exactly. They became widely accepted when their effectiveness was recognized.
Right.
It saved lives.
So harm reduction approaches are generally effective?
Yes, and they're promoted by the UN.
Mhm.
Yet we still see resistance.
It's unfortunate.
The third argument is about legal issues. Some claim that providing these centers would involve committing offenses. It's
Is that
debatable.
accurate? Can't local areas work with law enforcement to facilitate pilots?
Yes, if local law enforcement agrees, they can consider pilots.
That's
Collaboration is key.
Internationally, providers have good relationships with police?
Exactly. And in the UK, some police forces support their introduction. There's support.
That's encouraging. So if the legal framework is a barrier, maybe it needs changing?
Precisely. We shouldn't oppose the centers because of outdated laws. Progress
Agreed.
is needed.
Overdose prevention centers aren't a silver bullet, but they could help?
Exactly. They're one part of a multifaceted toolkit.
Right.
We need all the tools we can get.
Shouldn't we wait for more research before implementing them?
Well, further research is valuable, but when facing severe harm, the precautionary principle suggests we shouldn't delay action. Lives
see.
are at stake.
But could there be unintended consequences?
That's a valid concern, but there's no evidence these centers increase crime or drug use. The
True.
risks seem minimal.
So the safest response is to support their introduction?
Exactly. We need to act to prevent harm.
Absolutely.
It's the right thing to do.
Well, you've made a compelling case.
Thanks. It's crucial we consider every avenue to address this crisis.
Definitely.
It's a matter of saving lives.
Agreed, it's time for action.